November the 22nd, National Falls Prevention Week kicked off. And joining us with the tips on keeping people safe, we have physical therapist Sonia Rapaport and registered nurse Alicia Schwartz. We welcome you guys to the show.
Thank you.
Welcome, welcome, welcome.
Thank you.
All right, so wait a minute. National Falls Week.
Yes.
People are falling and they can't get up sometimes, and
Exactly.
you hear the commercials. And how do you stay safe?
Well, there's a couple things you have to keep in mind for sure. The environment and the person. Or you can look at it from the outside and the inside. We want to make sure our apartments are as clutter-free as possible.
Clutter.
Exactly. You don't want to fall over everything. Want to make sure there's proper
Oh,
lighting.
sometimes it can fall down on you if you have so much.
Yes.
That's for sure. I've been in apartments doing home care where the boxes were moving, but everything worked out well.
Yeah.
So you want to make sure that the environment's okay, furniture sturdy, high enough for older people especially to be able to get up and down safely. You want to make sure the lighting is good. And then there's the person. You want to make sure they're trying to stay as active as possible, maybe find an exercise that they like to do and will do. The clothes and the shoes are right.
Want to make sure that they use the proper equipment. There is equipment for them that they can use. Some individuals will go outside and they'll use their walkers or their canes, and then they come in the home and they won't use them because their home's supposedly safe.
Hang out on the wall.
Yeah,
On the wall,
exactly.
all the way to
And most of the
bathroom or
falls
kitchen.
occurs in the home.
Ah, okay.
You know.
Yes.
Are there things in place just in case someone falls and they can't contact them? Maybe they're far away from the phone.
Well, at VNSNY, we provide individuals with what's called a PERS machine. It's an emergency machine. So if they're supposed to carry it on with them, and if they fall, they can press that button and ask for help, and someone will come.
That's that thing. I fall and I can't
There
get
you
up.
go.
That's- yeah. And they advertise that on TV. How did they come up with this National Fall Prevention Week?
Well, it's huge. I don't think people realize how many people fall and hurt themselves.
There's actually 2.8 million individuals, elderly, that fall yearly. On that basis, 800,000 are hospitalized with severely injured,
Yeah, a lot
which
of people can't
means
take that fall.
hip fractures
Yeah.
and traumatic brain injuries, and those things can cause death.
Yeah.
So the Center of Disease Control says 1 out of 5 elderly are hospitalized for a fall.
Wow.
And it is among the highest cause of deaths in senior citizens.
Yeah.
So the more we can do to prevent it, the best. And it does coincide with the beginning of fall or autumn.
Oh, okay.
So that's how
Yeah,
they
when I
picked
first
out.
when I first took a look at that, I thought it was. Let me see. Wait a minute. Do they want to say that this is Falls Week? That the leaves are going to fall from the trees?
They can be slippery.
Very good.
There you go.
Yeah, but this is very serious, and not only in the home, right?
Now, not
No,
only
they-
in the home, though, most do happen in the bedroom and the bathroom and the kitchen.
You have to understand individuals, elderly, they're on a lot of medications. Some of them make them dizzy, and they're used to so many years just getting up and going. So
Yeah.
sometimes now with those medications, when they get up, they get dizzy. And they don't realize this, so they're used to
Sometimes I get up and get dizzy.
There you
just
go.
Getting
So-
straight up.
so
And
you
don't
need
even
to
have
make
be on
sure.
medication.
Right, you need
Whoa,
to make sure,
what
let me
happened
sit.
here?
Right, right, let me take my time and sit and make
Right.
sure, let me stand and count to 5 to make sure that I don't get dizzy. And if I do, the bed's right there, the chair's right there, and I can
Yeah.
just go down there.
Now, does this extend out to younger people too? Because sometimes you have sharp objects low, where
Oh,
people
sure.
can bump their heads, and
Well, I think
little kids, toddlers.
a huge thing now, well, toddlers, you can, they can be in the way, and
Yeah.
dogs and cats and pets, and that is a
Yes.
big thing at
Yes.
home.
Yeah,
If-
so
especially
a dog
if-
can trip you. Yeah.
A dog can
Yes.
trip you if you have white carpeting and a white cat, and your vision isn't as good as it used to be, which probably happens on a daily basis.
We go to restaurants nowadays and you can't see if the light is dim. So imagine an elderly with that dim light. So sometimes
yeah.
what we do is we refer individuals to either the lighthouse or Visions for the Blind, and they come in and they inspect the home for the proper lighting that they should have as
You
well.
said the lighthouse. I thought I saw something in the city on 23rd Street.
Yes.
Is that it?
That's
Yes.
it. That's it.
Yeah, it just
That's it.
lit up a bulb in my
There
head
you
and
go.
it went straight to 23rd Street.
Right, but falls are dangerous for all ages, and I have to comment that a lot of the millenniums are all ages. They're walking around on the street like this,
Wow.
and not good for your
Wow.
neck. Sorry, I'm a PT, And also, you almost bump into me, and I don't want to get bumped into.
And the elderly are now using cell phones,
Absolutely.
and they're walking like this. I mean, a couple of months ago, we saw a woman walking with her cell phone and go straight down.
I mean, that can cause accidents right now, but what will
Absolutely.
that do to you in the long term? I mean, you have to have great peripheral vision in order to see what's going on around you and stay focused on that
Well,
smartphone.
It really cuts down on your alertness for safety, falling. You know, I always say, okay, if a pickpocket is looking for someone, are they going to look at the person that's looking around and being focused, or are they going to look
Yeah.
for someone with headphones, you know, playing on their phone?
And they also run into cars.
Run into cars, bicycles these days. But
No
definitely.
texting and riding a bike. I see a lot of that happening. So.
So we wanted to make sure that elderlies are safe in the
Yes.
home because they're very vulnerable, and we want to make sure that they understand certain things that we wear, like shoes, open-toe shoes, they trip more. If you have your heel open at the back, you can either, when you're making a turn, your heel can come off. That'll cause a hip fracture if you fall on your side as well. So those are the things that we want to prevent, and let them know that we are there for them. We have the Visiting Nurse Service of New York. We have Partners in Care. We have home health aides that can assist you in the home
So
to get
who,
in
who
and
are
out
we
of the
speaking
shower.
to? We're speaking to the elderly.
We're speaking to the elderly.
and their relatives, because a lot of people, kids may live far away and wonder about. You can call a great home care agency. They can come
Let's
in and do
speak
an
to the elderly.
evaluation.
Let's
Yes.
speak to the elderly. I have 30 seconds on this camera right here, and then we're going to wrap up.
Hi, we just want to let you know that there are ways to prevent falls in the home, especially what you wear, what you put on your shoes. Make sure they're closed shoes, not open. Make sure that rugs, you don't have throw rugs in the home because that will cause a fall. You can trip, you can slip. When you get out of bed, make sure that you count. Don't get up quickly. Count. Have an answering machine. Don't rush for that phone. Make sure that in your home you have grab bars. When you're in the shower, a shower chair, grab bars so you can get out, because a fall in a bathroom is very detrimental. Everything there is very hard. And go ahead.
That's
Something
it.
else?
And if you have elderly parents, loved one, you could give us a call, any home care agency. We will evaluate the situation and make your loved one really as safe as possible.
And
What's-
always use your equipment when you're walking, either the cane, your walker, take it with you. It's important.
What's that number or website?
At VNSNY,
Yes.
you can call 212-609-1800 if you want to be referred to VNSNY Choice,
All right.
or you
Or-
can call Partners in Care if you need a
Partners
home
in
health
Care.
aide.
All right. Thank you so much. Give them a big hand, everybody. Sonia Rapaport, physical therapist, Visiting Nurse Services of New York, and Partners in Care. And Alicia Schwartz, registered nurse, VNSNY Choice Health Plans. Thank you guys
Thank
so
you.
much.
Thanks for
We have to
inviting
take a
us.
quick break. We'll be right back.